And then once again, the long circulating form of Gus, we saw no transport. So in summary, the addition of the IgG-Fc domain to the C-terminus of beta-glucuronidase allows transport across the placenta and delivery into the circulation and tissues of the fetus. Delivery across the placenta is dependent on the presence of functional neonatal Fc receptor. And the delivery is also dependent on amino acid residues in the Fc domain known to be necessary for binding to the FcRn. Another kind of unrelated thing I wanted to mention was that this transplacental delivery system could also be used to induce tolerance to a foreign protein prenatally. For example, an enzyme identified by bioremediation. We're presently trying to do experiments similar like that to induce tolerance, but I thought that that might be something additional I would mention. The last thing I'm going to talk about is our work with the chemically modified beta-glucuronidase that crosses the blood-brain barrier, something we're very excited about. Several years ago, we published experiments where enzyme replacement therapy is historically cleared storage from the visceral organs, resulting in clinical improvement for many LSDs. However, with these therapies, little enzyme crosses the blood-brain barrier, so limited improvement has been seen in the CNS. We have used chemically modified H-Gus to affect delivery across the BBB. We got this idea from the work that we published where high doses of Gus repeatedly over an extended period of time produce some clearance of storage in the brain. These high doses also resulted in delayed clearance of infused enzyme from the circulation. So we wondered what would happen if the BBB was exposed to an extremely long circulating form of Gus. So how do you create a long circulating form of Gus? First, you have to destroy the MAN6P recognition signal on the enzyme to prevent clearance by the MAN6P receptor. You also have to destroy the Mannose recognition signal on the enzyme to prevent clearance by the Mannose receptor. Both of these, fortunately, can be accomplished by treating the Gus with sodium metaperidate, creating what we call PERT-Gus. After we treated Gus or made PERT-Gus, we looked at the loss of MAN6P receptor or Mannose receptor uptake in human fibroblasts. And once again, when we use wild-type Gus, we see lots of uptake by those cells, which is completely inhibited by Mannose 6-phosphate. However, the PERT-Gus, in both the absence or presence of Mannose 6-phosphate, there is no uptake. And this is measuring Mannose 6-phosphate receptor-mediated uptake. Now, in J774E macrophages, we wanted to measure the Mannose-mediated uptake, Mannose receptor-mediated uptake. Once again, Gus is taken up well by these cells and inhibited by the addition of yeast mannan. But PERT-Gus is not taken up either in the absence or presence of the yeast mannan. So we seem to have destroyed those two uptake systems by the pyridate treatment. Next, we wanted to see if we accomplished making a long circulating enzyme. So we looked at the clearance of infused Gus or PERT-Gus from the circulation. Normally, Gus, when infused into a mouse, is removed from the plasma very quickly with a T1/2 of 11 minutes. But our PERT-Gus in 3 separate experiments, the clearance was extremely delayed with it had a T1/2 of 18 hours. So we hadn't been as successful at producing an enzyme that had a very slow clearance. So we looked at the tissue distribution of Gus versus PERT-Gus in perfused MPS 7 mice 48 hours after infusion with 4 mg/kg enzyme. Now in tissues such as liver and spleen that normally get a lion's share of the enzyme, very high levels with Gus, now with PERT-Gus are now getting less enzyme delivered to those tissues. Tissues such as heart, kidney, lung, and muscle, and eye, which normally get a lesser share of the enzyme, now are getting levels of enzyme anywhere from 2 to 5 times the level seen with wild-type Gus. But most importantly for us, PERT-Gus was delivered to the brain approximately 6 times the level that normal Gus was. And this is almost 7% of the wild-type level of enzyme. So this should be a clinically significant amount or level of enzyme to clear storage. So because of this, we set up a 12-week ERT experiment comparing Gus versus PERT-Gus. Here, MPS 7 mice were treated weekly by tail vein infusion for 12 weeks with Gus or PERT-Gus at doses of 2 to 4 mg per kilogram, or 2 and or 4 mg per kilogram. 1 week after the last infusion, mice were perfused, tissues collected, fixed, and evaluated for lysosomal storage. Both enzymes cleared storage in the visceral organs, but what about the brain? Here's the clearance of neuronal storage after ERT in untreated, GUS-treated, and PERT-GUS-treated animals. We looked in the neocortical neurons and the hippocampal neurons. In both of these neurons, the arrows indicate substantial storage in the brain. Treatment with GUS cleared this storage just slightly, but treatment with PERT-GUS completely reverses storage in both of these locations. So look at a little higher magnification of just the untreated and the PERT-GUS. Here you see massive storage, here you see nothing. And the same in the hippocampal neurons. Here you see lots of storage, here you see almost nothing. So it seemed to be very successful at clearing that storage. How does PERT-GUS cross the BBB? The truth is we don't really know. We have some ideas. It could be transported across the BBB by fluid phase penocytosis, or it could bind a low affinity receptor that only delivers enzyme across the BBB in the absence of the MAN6P and Mannose receptor delivery systems. Or PERT could possibly modify the GUS, which allows recognition by a novel receptor in brain microcapillary. Or it could be taken up by circulating macrophages, which then carry it across the BBB. So in conclusions, parietate treatment of GUS and it activates the MAN6P and Mannose recognition markers on the enzyme. As a result, PERT-GUS has a greatly increased half-life in the circulation. This allows increased opportunity for the PERT-GUS to be transported across the BBB, and once across the BBB, PERT-GUS clears lysosomal storage in neocortical and hippocampal neurons. Just like to thank all the various people involved in all of these projects in the St. Louis skyline. Thank you for your attention. I'd be happy to